The National Health Council is developing a framework so that we can evaluate the usefulness of any comparative effectiveness research. We know from our patients, the people that we represent, that they are very supportive of comparative effectiveness research, but they are concerned that there not be one size fits all and that it be used in the most appropriate ways and that they not be denied any access to care. So the framework will allow researchers to identify the right questions to ask, and it will allow research funders a better way to know which research is most important to patients, and then eventually get that research that is useful for individual patients and their providers into their hands so they can make better healthcare decisions. The National Health Council's goal for developing a framework for evaluating the usefulness of comparative effectiveness research and usability criteria is to ensure that the research is in fact useful at the point of care, so that as a patient with my provider, the research that's generated from comparative effectiveness research has been evaluated in a manner that means that I will receive it so that I know if it works for me or it does not. And there are a lot of steps along the way, but with these criteria and the framework, we believe it will help the entire research enterprise conduct better research and get it into the hands of the people that need it more quickly. So the framework that the National Health Council is developing that will help evaluate comparative effectiveness research and how useful it is has several domains. And in our work so far, we have determined with many of the stakeholders that the most important domains for the National Health Council to address on behalf of patients are the domains of meaningful, trustworthy, and translatable. So simply, meaningful will be, it will include the fact that the right research question is actually asked. So there's a lot of work up front, but it really comes down to it's going to be meaningful for me as a patient if the question I care about is the question that's asked and answered in the research. Trustworthy means that clearly we can trust the results. There are numerous things also that go into that particular domain, but we'll be looking at is the research reported in a manner that is transparent, that is comprehensive, so I will have a good sense of where it fits in the actual care that's available today. And then last but not least is translatable. And for us it means not just translatable so that people in general understand it, but that it is actually translated from the research itself into practice through vehicles that are important to patients, that are trusted resources for patients, so that by the time they receive it, it's understandable, it's coming from a trustworthy source, and they can put it to use right away. We have a lot of work to do to flesh out the criteria and have them be more useful. So one of the things we're going to do is we're going to take the criteria that we have developed against the three domains, meaningful, trustworthy, and translatable, and we're going to lay them out linearly so that we can see where the particular criteria are most relevant. And then we're going to also break them up so that we can look at the different stakeholders in the entire research enterprise and healthcare system, and we can be clear about which of those criteria are most important for which of the stakeholders. And I think that will help us then develop them further, refine them for particular audiences and purposes, and then of course we'll validate and pilot those.